The Ceylon National Association for the Prevention of Tuberculosis was the brainchild of the late Dr. J.H.F. Jayasuriya. He realized the need for a voluntary organization to augment the efforts of the government to control the disease. He conceived the idea, implemented it, and eventually built and nurtured the CNAPT into a very effective organization. Today, we are indeed indebted to Dr. Jayasuriya for his pioneering vision. It was in his capacity as chairman of the Rotary Club of Colombo that Dr. Jayasuriya first resolved to set up a voluntary organization under the auspices of his club to help combat the disease. The inaugural meeting of the association, which was held on the 17th of June 1948, just a few months after independence, at the town hall in Colombo, with the Governor-General, Sir Henry Monkmason Moore, presiding, was attended by a distinguished gathering, which included Mr. S.W.R.D. Bandaranaike, the Minister of Health and Local Government, and Dr. S.F. Chellappa, Director Medical and Sanitary Services, and a committee was also elected at this meeting with Dr. J.H.F. Jayasuriya as chairman. Subsequently, CNAPT was incorporated by an Act of Parliament in 1957.
The CNAPT is the oldest NGO in Sri Lanka. It was formed in June 1948. It was formed to assist the government's effort to cure TB amongst the population, among whom the disease was then rampant. At that time, people were ignorant of this disease. Also, there was a social stigma about the disease that prevented people from seeking medical help.
CNAPT's achievements of the past 6 decades clearly demonstrates the significant contribution voluntary efforts can make towards the control of TB on a national scale. The acceptance by the public of the importance of the role of the community in this campaign has led to the emergence of the CNAPT as an essential community agency playing a major part in the nation's effort to control tuberculosis. The CNAPT has always been conscious of this need and has been striving to harness the resources of all sections of the community. The early work of the CNAPT has to be viewed in the context of the TB menace that had existed more than 60 years. The disease was then rampant. Medical treatment was in its infancy, and a proper regimen of treatment was yet to be evolved. The disease was often fatal and created a social stigma that prevented patients from coming out and seeking treatment. The efforts of the government were woefully inadequate to cope with the situation. The CNAPT, as a voluntary organization, strove to assist the government in addressing the needs of these patients. A principal concern 60 years ago was the plight of the children afflicted by the disease, for whom there was no special hospital accommodation. The CNAPT stepped in to remedy the situation by building special children's wards in hospitals. These were the Valisara Children's Ward in 1952 and in 1955 the Clarence Nathaniel's Memorial Ward, which together provided a total of 165 beds exclusively for children. These are now functioning as general TB wards. The Hawke Memorial Wards in Kandana were set up on the 11th of June 1956. In 1989, these wards were converted to serve as a nurses' training school. The entire construction cost of these wards was raised through the efforts of the CNAPT. This ward was declared open by Prime Minister S.W.R.D. Bandaranaike, while the Governor-General, Lord Salisbury, and the President of Rotary International paid official visits to the Valisara children's wards. The CNAPT also initiated a home visiting service for patients for the first time in Sri Lanka. In the 1950s, there was hardly a regular system of home visits by personnel from the Department of Health for the purpose of educating patients and their families about the disease. CNAPT conceived the idea of organizing visits to homes in Colombo to create TB awareness. The home visiting service was inaugurated by the Prime Minister Dudley Senanayake on the 25th of February 1953. Provincial chest clinics as a means of controlling the disease was another important CNAPT concept at a time when only Colombo had such facilities. The first such clinic outside Colombo was built in Galle at the insistence of CNAPT. The Tasim Chest Clinic was named after Mr. A.R.M. Tasim, the mayor of Galle, who was the president of the Galle branch of CNAPT. The association also pioneered financial assistance to TB patients. Other measures included the setting up of the rehabilitation centre at Kadawatha. In the early 1950s, patients discharged from hospital found it difficult to obtain employment, one reason being the social stigma associated with the disease. The CNAPT embarked on a program to promote self-employment as a solution to this problem. Accordingly, the CNAPT decided to provide vocational training, and tailoring was selected as a suitable vocation. The CNAPT was managed from Dr. J.H.F. Jayasuriya's home. Realizing the need for suitable headquarters, money for the construction of the building was collected from friends and well-wishers. This two-storied building at 51 Edinburgh Crescent, now Sir Marcus Fernando Mawatha, was declared open by the Prime Minister S.W.R.D. Bandaranayake on the 7th of June 1957. The work of the CNAPT was decentralized with the opening of branch associations around the country. At one stage, there were 44 such branch associations. One of Dr. J.H.F. Jayasuriya's cherished aims was to build a permanent centre where exhibits for the promotion of health education could be displayed. He also collected sufficient funds to construct one. The proximity of the spacious two-storied health education centre to the Colombo Museum provides a special advantage in that school children from all over the country who visit the museum could opt to visit the health education centre next door as well.
Our strategy today is to help the government in the community aspect of the program. So we have got the teachers, the people, the children, all of them involved in our programs. And we find if we assess the success of this program, we are doing very well to make our awareness objectives achievable.
CNAPT has undertaken and has now been officially entrusted with the task of promoting health education. The medium-term plan for the control of TB in Sri Lanka, as formulated by the Ministry of Health in the late 1980s, envisaged a special role for the CNAPT. The CNAPT was officially assigned the task of handling all matters relating to health education in the plan. The Global Fund Against TB and Malaria, GFATM, has assigned to the CNAPT the responsibility of implementing a school health education program. CNAPT has held the chairmanship of the South Asian region since 2008.